In a case of enuresis or bedwetting, using our mnemonic old cards will note the onset, or when did you first notice your child's enuresis. For the duration, we'd like to ask mom or dad if it's occurring constantly, i.e. every night, or if it's more intermittent. If that's the case, we'd like to note how many nights per week. Next, we'll want to note the progression. Does your child's enuresis appear to be occurring more frequently or more severely? Or if there has been no progression, we'll also want to state that in our patient note to show we've asked. To help characterize enuresis, we're going to use our technique of pre, present, and post, as we'll see below. And since enuresis is a bodily fluid, we can ask now or later under our present column about the ABCs for our patient note, the amount, if there's any blood in the urine, and the color. Aggravating and alleviating factors, and for treatments we can ask now or later under our post column if any were tried, including an enuresis alarm or TCAs, as we'll see below. In all pediatric patients, instead of a physical exam, we're going to use our mnemonic BITTER to remind us to ask about the birth history, immunizations, developmental history, diet, education, and to reflect with the parent. For all cases, let's order a physical exam, CBC, serum electrolytes, a urinalysis, urine culture to rule out a UTI, serum glucose and A1C to rule out diabetes, and a BUN and creatinine to rule out kidney disease. Before we make the diagnosis of primary enuresis, we want to be able to rule out a UTI. For a UTI, our supporting points will include polyuria, dysuria, abdominal or flank pain, and fever noted in the vital signs if we were given, or in our review of symptoms. Anytime we have a fever, it's always going to be concerning for an infection. For diabetes type 1, we'll see polyuria, polydipsia, and a weight loss. And for the diagnosis of primary enuresis, we'll set up our columns pre, present, and post to ask mom or dad the nighttime routine, including if the child is drinking or snacking excessively before bed, or if they're using the bathroom before bed. Presently, we'd like to know in their urine what is the ABCs, or the amount, if there's any blood in the urine, or the color in general. And we'll ask, does the enuresis awaken your child from night, or if there are any other night problems while they're sleeping, including snoring, insomnia, or nightmares. So in general, any problems at night. And finally, in our post column, we'd like to know if there were any treatments to date that were tried, including an enuresis alarm, rewarding dry nights or punishing wet nights, and or medications, including desmopressin or TCAs. Or if there were no treatments tried to date, we'd also like to state those pertinent negatives in our patient note to show we've asked.